Is this thing on?
I am Queensborough.
Hi, everyone. My name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. Everyone, Chrissy is back. She is Yep, she is back on the podcast, and I'm super excited for today because we are going to access. Great. It is 9 p.m. on a Monday, and this is how I'm feeling right now. I apologize in advance if I start to slur my words. Great. This is before wine as well. But a big topic that I wanted to discuss, I've actually been kind of talking about this a lot with colleagues and just like other PTs in general, but a big part of what pelvic floor PTs do is a lot of internal examinations. It is kind of what sets us apart from other PTs. So we tend to do internal vaginal and rectal exams to see like what's going on in the pelvic floor. Now, Chrissy and I actually just discussed this, but there was a post on Instagrams with a person who will not be named, a person who will definitely not be named, but there was a post on Instagram months ago. This was months ago, right?
Yeah, it was a while ago.
Totally.
Yeah.
And I just remember seeing it and I was like, "Ooh, this is going to spark some arguments for sure." So, pretty much what the post said was, if you don't do internal exams, you should not be considered a pelvic floor PT. Now, lots of tea with that. And I have even, since I saw that post, I have asked plenty of practitioners about what they feel about this. And I must say, most of them do say that if you don't do internal exams, you should not be considered a pelvic floor PT. Now, I will give my opinion first, and then Chrissy, you could totally give yours afterwards. But I must say that I do agree. I do agree with this. I think now, this was something that people were saying underneath the post is that like, well, there are plenty of patients that come in and like they don't need internal work and stuff. And what the person who posted it said was like, that's actually not what I'm saying. She was like, I'm saying, that you should at least be qualified, and like, certified. You should have taken courses in order to assess the pelvic floor muscles, and that I must say I do agree with. Now, how she posted it and stuff too, I do think was a little like it was very like this is my opinion, and if you think something else like it's wrong, which I think should never be the case. I think everybody should always have their opinion. However, I must say after being in this field for however long, I do agree. Chris, how are we feeling?
Absolutely. I completely agree. I think it was funny what you mentioned at first that some practitioners say, well, that person doesn't need internal pelvic floor assessment or treatment. And my question is, well, how do you know that if you didn't do it?
Totally.
How do you know that there isn't a pelvic floor issue if you didn't do an internal assessment? You can have an idea, and I have been in situations, and I'm sure you have been too, Liz, where the patient does not want to do internal, or you're doing virtual because of the pandemic, and you have to use your clinical skills and have a really good idea of what the patient is going through and what the issue is, based on what their symptoms are and what objective measures you can get through visual, or like palpation externally, or, watching through a computer and seeing how they move. But it really is not the same, and there's no 100% way of like reassuring yourself or the patient that you know exactly what's going on with the pelvic floor. There really is no other way.
I actually think that that is such a good point. That's such a good point because there are plenty of people that come in and they're just like I so now for me I do work in a pelvic floor clinic. So a lot of the times my patients are researching, like what it entails and stuff beforehand. So they come in and they know what's happening. But when
Yeah.
I worked at my first job, uh it was something that was more so brought up to patients. It was brought up to them. And then we would treat them and do a pelvic floor evaluation. So sometimes it would take a little bit. Now, granted, I'm not saying that I don't have patients that come in. They're like, ooh, do you think like can we not do internal today? Or like, is it okay if you just explain to me a little bit more about like what's going on? And I always try my best to do that too. Like I always try to let them know, like, listen, like this is exactly what I'm going to be doing. And I'm going to let you know every movement that is going to be made in this session. That's exactly what we're going to do. You let me know if you're uncomfortable at any point and we go from there. That's all you can do. Um, but that's a huge difference, though, of somebody coming in who may have gone through like some sort of sexual trauma or whatever it is, where they even as you're doing the internal assessment, they might say, I gotta stop, like, and I can't
Right.
do this, and that's okay. And then that's where, as a therapist, you have to say, all right, let me check externally. Let me then now look at, now it's time to look at your abdomen. Now it's time to look at your ribs, your back, whatever else I can do to help you today, I'm going to do that.
Yeah.
But that is very different than somebody who is going to call themselves a pelvic floor PT, yet you don't know how to do an internal assessment. That I don't think is okay.
And I think that it would be interesting to call yourself a pelvic floor PT if you don't know how to do an internal assessment, because if you don't know, it's because you haven't taken any courses that would train you to do an internal assessment, because we don't learn this in PT school.
Yeah.
PT school goes through, at least most programs. I do have an understanding that there's a few programs that dive a little bit deeper into it, but for most programs, you know what it was like for us. Listen, I went to the same PT school.
Yeah.
And
Yeah.
I think we had one class on pelvic floor, and it
Yeah.
was basic anatomy and sort of function, origin and insertion of the muscles.
Yeah.
Like,
Yeah.
that's important, but not at all what you need to assess a patient or like see
Not,
issues or how to create a plan.
oh my gosh, not at all. Not at all. And like, I mean, shout out to our professors because like y'all are great. Like
Yeah.
it's like nothing against you guys at all. That's obviously like the curriculum's issue, not
Mm-hmm.
theirs. And I'm really hoping that that changes for our school eventually, because like I really think we had just such a great program, so for that to not kind of be within it and everything too, you remember they would ask us questions. Our friends would ask us
Mm-hmm.
questions
Right.
about things like for
Yeah.
the boards and stuff. And like that kind of said a lot that you guys are now asking us questions. A third
Mm-hmm.
year? Like you're asking us, so it's I always found that very interesting too, but it did make me realize like, wow, there is a whole new world out here that like we just don't know about. So, and I do have colleagues that went to like NYU has models come in. They have
Oh wow. Okay.
oh yeah, like anatomy models come in and like they're able to do assessments on them. So that's even a step better where you're not doing it on your classmates. Cool.
Mm-hmm.
Like
That's awesome.
that's so awesome. So you're able to then do that, and they were at least able to practice an internal exam, which I think is a very different ball game. You're able to assess certain muscles, and that's that. If it's not for you, cool. That's fine. So that post, it just like, it sparks up so much stuff for me because a lot of people, and this also goes back to just like some of the issues of social media, I think in general too. Whereas some of these people answering, right? Of course you have the people that are like, preach, yeah, nah, like, yeah, like, yeah, you say it louder for the people in the back, they're like going crazy over it. But then you had some of these people, yo, so I remember this one lady, she was like, you know what? I don't appreciate this at all. Like during the pandemic, I was treating people virtually and I was able to help a lot of people. What really got me going, and I had to read all the comments at this point with this, but like a lot of not practitioners, but other people on social media that like are patients, may have been a patient or something. So they were commenting. And one of them was like, I've actually never had internal work and my pelvic PT was amazing. And she was like, I know that I needed internal work, but I just preferred not to have it. And I think it was due to like culture and religion and stuff. But like, which I get, I 1000% understand that. However, again, you're kind of like you're missing that point though of like what she's trying to say. But then that also kind of goes into like, there's a way to say something. Like there's a way to state your opinion too, but without bringing up all this other stuff, right?
Especially with a subject like this one. And I think one of the other comments that I saw on that post were, well, what if you don't have consent? And it's obvious to us as pelvic floor PTs that if you're
Yeah.
doing an internal assessment, you have consent because we are super trained that that's the first thing, before you even start your eval or start getting any other objective assessments, you explain what an internal exam is, why you're doing it, why you're doing that assessment, how it's going to help you create a plan of care and treat the patient better. But I understand how people can think that. So the other day I had a patient, male pelvic floor patient. He came in and we started talking. He was older, we started talking and I explained, what an internal assessment was, how I was going to palpate pelvic floor muscles, look at tone, look at weakness, coordination, all that. And I asked him straight up because I like to personally just ask specifically, is this something that you consent to? Do you agree to this?
Totally.
Right?
Yeah.
Because I don't want anything left open for interpretation.
Mm-hmm.
And he responded, well, what else am I going to do? Say no? And I was like, absolutely. And that's what I think patients and pelvic floor PTs should understand, that absolutely they can say no.
Yeah.
And that's okay. And like you said, I'm going to do my best to treat you in the best way that I can with every other piece of information that I gather. I can't tell you that's going to be as good of a treatment as if I had done internal because I don't know, I don't have every piece of the puzzle.
Yes.
But absolutely, you can always say no. And like you said, it could be cultural, it could be just, you're uncomfortable, and that's okay.
Definitely. So even it's so interesting, like even when he answered back to you, because then I would definitely get on a soapbox and like with that patient and just be like, actually, you are always allowed to say no to me. Like you are always allowed to do that. I definitely some of my patients, especially the ones that I've been seeing for a while, and they know exactly what the ball game is. As soon as they come into the room, they know that we're going to be doing internal work and and all this stuff. And I still say, I like pet names, love, honey, the works, and I'm always just like, you ready, honey? Or yeah, you ready, boo? You ready, love? And they're just like, yes, Alyssa, I know what I came here for. And I'm like, yeah, well, I'm always going to ask you. I'm always going to ask you. That's never, I was like, that is never going to change. I'm not, before each session, do you personally consent to me doing this? Do you do, no. I'm not always going to say that, but, I talked to them about consent. I think it's very important. And you know what? I can't blame even your patient for asking that, because you know how many practitioners are just like, yep, this is what we need to do. Okay, great. Fingers here. Dip, 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 dip. And then that's it.
Or they don't say anything and they just start doing things.
Exactly. And that is a pattern that I never want to fall into, where I just start touching somebody without them not knowing what I'm going to do. And my patients, like, I probably sound so repetitive sometimes to them, but you know what? I'm always going to let you know what I'm going to do, why I'm doing it, and all of that too. Like that's just always going to be a thing. But yeah, and oh, there are so many things. There are so many things. I just think that this is also something that definitely just sets us apart. It sets us apart. It's like I have had patients, especially being in this full time officially, too. It's like I've definitely had patients that like no issues with peeing, no issues with bowel movements,
Mhm.
and just painful sex. And sometimes they don't want an internal assessment. So there are times where I say, I'm like, okay, okay, that's fine. But what I do then explain to them is, well, if the issue is painful sex, what I also like to do in my sessions is like we try to simulate that. And now I know that's going to come across as like sexual and weird and all that too. But how am I supposed to know now what this might feel like for you if like I can't assess it? If I can't assess like
Absolutely.
what your muscles feel like, and if I can't do that. And honestly, a lot of the times that's when they're like, "Oh, yeah, because a lot of times they're afraid of the internal assessment because they're like, if sex is bothering me, how the hell is this exam gonna, like what's gonna happen here?
Mhm.
So yeah, and sometimes you just need to like explain that. However, if somebody does say if they say that to me, a lot of the times I still won't do an internal exam on that first visit. I'll say, listen, yeah,
Of course.
let me do what I need to do, like let me check externally, maybe let me look at your vaginal tissue, your perineum, your, whatever it is, whatever you're coming in for. Let me now look at that and
Mhm.
see what's going on. Um, another thing that has been coming up a lot lately, and I actually think that this is going to change kind of in pelvic floor world, is rectal exams and like the importance of rectal exams. I have now, I'm not going to lie to you, with my chronic pelvic patients, I have more often than not been doing many more rectal treatments with them, and it has been the biggest game changer of their treatments. Like for patients who have like interstitial cystitis, or just like chronic pelvic pain, that has been such a game changer for them, and it's honestly mind blowing. Like it's mind blowing to me.
Yeah, and I think a lot of us forget, and I was guilty of this too prior to treating, because at the beginning I wasn't really treating constipation, I wasn't
Mm-hmm.
treating males, so I didn't really. I thought this was my misconception. I think a lot of not only pelvic floor PTs but practitioners in general
Mm-hmm.
think, well, why go into a rectal internal assessment when you can go vaginally, or when the problem, quote unquote, isn't there,
Yep.
but it is there,
Yep.
and you
Actually
don't know
there.
it.
Uh-huh.
Yeah.
I thought the same though. I mean, like, yeah, of course I thought the same. Like if somebody didn't have constipation, or if nothing is happening rectally there for them, then I would just say like, okay, cool, vaginal it is.
Hmm.
Whereas like I have plenty of patients now where if we are not seeing any more changes and your vaginal tissue feels fine, listen, we're going to have to do it. And luckily with that too, a lot of the times they then know me so much better, at this point too, that they're like, listen, I don't care what you do. Just do it. Just, yeah. I
Yeah.
don't care what you do. You do your thing. That's fine,
Hmm.
and it's always, rectals, of course, very different. It's a very different ball game because now I am not knocking anybody who likes anal play, okay? You do you. You always do you. However, like biologically and physiologically, we are only meant to have things come out of that region. Like technically,
Right.
when you think about it, we are
Hmm.
only meant to have things come out of there. So it is always an area where people get very nervous about. They get very nervous about. And I'm just going to straight up say something to you, but I have even had a lot of gay patients, a lot of gay
Hmm.
patients who like they too, they get very nervous about these things, even though they have had plenty of like anal play. I have plenty of
Hmm.
women who enjoy, who enjoy doing things like in that region and stuff too. And even for them, they're just like, oh nah, no, 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 and like, listen, like, guilty. I do too, okay? And if somebody
Hmm.
was going to assess me there, I would probably freak out a little bit.
Nervous
Like
too.
I
Yeah.
would I'd be so nervous. So I think that it is something when I think about things logically, which I try to do as much as I can, it's true. We're kind of only meant to have things come out of there, no matter what you like, no matter what it is. But in a vaginal canal, we are meant to have things go up. So it's a
Mhm.
lot easier for people to kind of understand that. And also, if we're just kind of going like with women, or if you identify as a woman or somebody who has like vaginal tissue or a vaginal canal, then we have more likely than not been to a gynecologist too.
Absolutely.
You're
Yes, that's
used to
true.
getting checked out. You're used to that. Which oddly enough is sometimes a reason why my patients get nervous, because they're just like, oh my God, this is going to hurt so bad. And then we do assess them and they're like, why wasn't it as bad as like, sometimes a
Mhm.
gynecologist? And I'm like, we're like much more gentle than like that, like we're much more gentle when
Yes.
we do an assessment and stuff too. But yeah, rectal exams are now becoming more of a thing, and there are plenty of practitioners who have already made it a thing. They just aren't on the soapbox of like social media, I think. Like they're
Yes.
not they're probably just not out there talking about it, as much as somebody like posting something about it would too. So I just think it's very interesting that it's becoming more normal. We actually have a student in the clinic right now, and like one of my patients that I treat is young and is a PT student as well. And like she has
Oh.
chronic pelvic pain. So I was talking to both of them about this, because like she even said to me, she's like, Alyssa, listen, like as soon as we started doing this, like it was a game changer for me, this rectal work. She was like, and she was like, I can't believe it. I can't believe I'm saying that, but it's true.
Yeah.
It's true. It was such a game changer. And I was kind of talking to the student about that too, how like when something's not working, change it up. Change it up, right?
Yes.
Yeah.
Doing the same thing over and over again, expecting the same results is just crazy.
That's a
It's just not
quote.
gonna.
That's like a quote
Yeah.
from saying that's
I don't
insanity.
know whose quote it is,
Is it
but I definitely took
Einstein?
it from someone.
Is it Einstein? I'm gonna look it up. I'm gonna look it up. Hold on. I have to. I have to now. Doing the same thing over. I can't type for the life of me. And expecting a different result. Here, hold on. Doing insanity. The definition. Doing the same thing over and over again, expecting different results. Einstein. It's Einstein. Dope. Love it. Love it.
Man,
Maybe
you're good.
maybe my brain is, see, like these are the things that I know though. These are like this is like what's
The
in
thing you remember.
this is what's in my head right now. I
But
can't.
it's true. If you're doing, or so that's something that was very interesting during the pandemic. I did virtual for about 3 months straight of just virtual for the clinic I worked for, and which was very interesting because I feel like my pelvic floor cases and pelvic floor patients just spiked up during the
Mm-hmm.
pandemic.
Oh yeah.
Obviously, there's a lot more stress, and a lot of us hold stress in pelvic floor. There was just a lot going on. So what I did find, and this was something that I got really frustrated with, is that a lot of my patients were taking longer to get better, or there was inconsistency in results. Just like an example, one of my patients had a lot of not a lot, but a significant amount of urinary and fecal incontinence at times. And because I could have an idea of what her pelvic floor tissue looked like, and I objectively saw other tests and did other tests and assessed other things, I created a treatment plan based on that because we were virtual, but it really frustrated me that she wasn't getting better quicker as I would expect her to if I would have just known what the tissue looked like and what it felt like and what the real issue was, because you can't, and this is what I used to tell her, and I felt so bad, and I was like, I don't have a magic wand, and I can't see it, and I can't know exactly what's going on. Like, I can try to help you in other ways, but it is frustrating when you don't do internal and you have no idea what's going on.
Totally. And I think even like what you just said, first of all, is like a beautiful thing as a practitioner. You were very honest with her. You were very honest and you said, like, I don't know pretty much, like what else to do
Hmm.
because I can't see your tissue. And I always think that you are much better off doing that. You're much better off being honest about something than saying, unfortunately, there are people out there that are like, oh, no, 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 you're going to get better with this. Do you know how many times I hear that from my patients? That shit pisses me
Hmm.
off so bad when I hear that from a patient. And I say to them all the time, I'm like, I cannot make you promises, but I have gotten people better. That's what I say. I go, I have gotten people better where it's work from you and it's work from me. And like, we got to work together. We have to communicate. That's what we need to do. If we can follow those rules together, I'm hoping I can get you better. And that's all and that's what I go off of with that. And a lot of the times that ends up working out. Like that ends up working out well for my patients, because then they're like, oh, okay. They're like, okay, cool, like great.
Yeah.
So I think, oh man, I feel like we just talked about so many things.
I agree. But it is what we go through with deciding on, well, we never really decide on internal versus no internal. If it is a pelvic floor patient, it usually, you decide that you would like to do an internal exam assessment. If the patient wants it or not, or it gives consent or not, that's a different story. But usually the case is that you do want it
Oh, yeah,
to do it.
definitely. And then also, just because I do an assessment doesn't mean I'm going to treat it either. So
That's a good point. Yeah.
yeah, just because I'm doing that doesn't mean that like that's going to be a bulk of our session. Like one of my patients right now, I'm not going to lie to you. I ended up being very wrong about what his pelvic floor felt like. He came in, he's talking to me about peeing too much. He's a runner. All leaking, all of these things. I'm thinking his pelvic floor is going to be the tightest pelvic floor in the entire world. And I even stated that to him before, checked him out, ended up being so lax. It was so lax and was weak in a different way, because of course, we know like weakness is also with tightness too of the pelvic floor. And I literally said to him, I said, well, dang, this is not what I thought. And I said, it's very straight up. And he goes, oh my gosh, yeah, like this actually like isn't very painful, at all. And he even felt better with that too. Because I was kind of prepping him for it. I was prepping him for that. And straight strengthening, like we definitely like his program is a lot of strengthening. Don't get me wrong, like a lot of stuff going on with his alignment, so like we kind of had to tackle that a little bit too. But I now check his pelvic floor to just like assess. I'm like, yeah, let's do this. I even do it like as we're doing certain exercises to see like how much he's activating it, like while we do bridges or, like any, like a straight leg raise, just like certain exercises to see like what's going on there. But that's it. I'm not really treating it. There's like no massage happening. There's nothing like that. So that's another thing too. It's like you don't always need to treat like that. Just because you're assessing the pelvic floor doesn't mean you have to just be doing like this internal massage for like a half hour. That's not the case at all. So I feel like, I mean, we totally just went on a rant about, of course, topics relating to this, but it's like at the end of the day, we're obviously pushing like doing internal work more than not. And with that post, that like we talked about in regards like to the one on Instagram, it's kind of like we definitely agree, but I also think that there's a way to say it. We're not saying that if you end up doing more external work as a pelvic floor PT that you're not considered a pelvic floor physical therapist. However, it does make me cringe if I know that a PT is out there and they do not have the credentials to do an internal exam, and for the muscles that you now are saying that you are either specialized in or certified in, and you don't know how to assess them in, I guess, the proper manner. Like, you can choose to do whatever you want to do as a practitioner. So if you chose to not do an internal exam, that's on you. You do you. Cool. That's fine. But like, you at least have to be qualified. in order to do
Yeah,
that. So like that's kind of my stance on that.
absolutely. I completely agree. And I mean, there's a reason why there is specialized training for this.
Yeah.
There's a reason why. If it was just regular ortho,
Yeah.
not saying that ortho PTs can't treat, incontinence. They could they treat it as well as a pelvic floor PT or as thoroughly? No,
Yeah.
I don't think so. But not saying that it's impossible, but you're not going to get the same benefit from it. You're just not.
Totally. And I wholeheartedly agree with that. Wholeheartedly. Now, I definitely wanted to bring up one more thing just because like we do have a student right now and I think she's so interested in like pelvic floor PT but like is definitely nervous about like internal work and stuff too, which like is totally fine. And like I even had her treat me because like my pelvic floor a hot mess. Like hot mess express. And like honestly, like I said to her, I go, I honestly think it's better that you treat us before even, like attempting with a patient and stuff too.
Yeah.
So, and you could tell that like her mind is just like reeling, sometimes with like internal work. So, what I wanted to kind of bring up was like if you were to kind of give anybody, like a student or even like a practitioner advice on like if they were to go into pelvic floor, like what would you kind of tell them? Like what would you say to them?
I think that a lot of times students or PTs that are thinking about going into pelvic floor are hesitant because of the fact that the situation may be uncomfortable or awkward with the patient, which it can be. It happens.
Oh my God, every day. At least for me, sorry.
Oh yeah,
Yeah.
For me too. I mean,
Yeah.
it's not always smooth and it's not always perfect, especially with the patients that are new or that have been through trauma.
Oh yeah.
Or that, have pain with sex. It's not going to be easy. But I will say that it is more comfortable than you think.
Yes.
If you know and you have the knowledge, the patient feels comfortable and they can tell that you have the knowledge. Just by you speaking to them about this before, that's one thing that I've always told students or anyone that's asked me the question is, if you explain exactly what you're doing and what the pelvic floor muscle layers are, and you go into detail about it, not a 1-hour lecture, but if you spend 10 minutes explaining to the patient exactly what you're going to do and what you're assessing, by the time you do your internal exam, their patient is much more comfortable, and you are too, because you know what you're doing.
Totally.
So it's not as bad as, anyone would be scared the first few times, but it does get easy.
Yeah. Yes. No. And it does. And it does. And it's so funny because like, and that's exactly the advice that I would give to and exactly what I told, one of our students, I definitely said that. I was like, listen, like this takes practice. It is not just like anything else. Just like anything else. I was like, my first ortho patient, I was like shaking in my boots. It's just like it all takes practice. And I said to her, I was like, the more you see bodies, the more you get comfortable. Like now I throw on gloves like it's nobody's business, and I grab that lube. Like, it's like clockwork for me. It's definitely like clockwork. But then I said to her, I was like, you don't think I have some patients that come in where never where I'm like, oh my gosh, I don't know what I'm doing, but where like they might be rude or something. And like I get now nervous to now do something with you. There's all this stuff that goes on in your head with all these things because it's like, and I hate to say this, but it's like, it's not just like a typical ortho patient. Like this is not an ankle sprain. You are now like a rude person. Like you are like you're now a rude person and I'm about to do like an internal assessment. You don't think like my mind is like reeling a little bit now and like I'm a little nervous. Like how do I fix it? How do I go about this? So that was what I was explaining to her. I was like, but at the end of the day, you do have to take the reins and you have to just do that. So it was the same thing you just said, like taking that 10 minutes before you then do the exam is a very crucial 10 minutes. It's a very, very crucial 10 minutes to just say like, I do know what I'm doing, and like I am qualified in this and I'm here to help you. I'm very much so here to help you and this is what I'm going to do for you. Um so that is what I've definitely been telling our student that's with us. She's she said she was like, I just you guys talk to patients and this flows, and I go, yeah, because we work full time, and we're here every
Yes.
day, you're learning. And I was like, I was there too. Of course, we were all
Yeah.
there. We were all there. So I think that would be my biggest thing. And then another big thing I would say is like coursework is like
Yeah.
so huge, and like continuing ed. I feel like I'm always trying to take like a continuing ed class just to not know. They're like too expensive for me right now, I think, like pandemic stuff.
Yeah.
Oh, rough times. But like I think it's very important to take, and I feel like that would be like my piece of advice with that. If you're a seasoned PT, say you're a seasoned PT and you do want to go into pelvic floor, I would definitely just say like continuing ed and mentorship. If you can find somebody that you can shadow to like watch an internal exam, or like luckily if you're able to like practice on a patient and stuff too, with somebody there like a mentor or something, I think that is such like a big thing, and I think a crucial part of like our practice is to be able to have mentorship.
I completely agree. And part of being a mentor and being able to be a mentor is, and this is my other piece of advice, you really have to love it and you have to have a passion for it.
Yep.
Because I feel, and this I actually heard from, this person wasn't my mentor, but she was a pelvic floor PT. She made a comment to me once of like, I'm in people's vaginas and rectums all day and I don't even get paid enough. I completely understand what you're saying, that, okay, maybe you should be compensated better, or you're not okay with your salary. I'm all for it. You have to value yourself as a person and be compensated for what you're doing. But you do have to love it for what it is. Because if a lot of pelvic floor, not a lot, I won't say that, but I know that pelvic floor PT is becoming a more common topic, or a more interesting topic for PTs, because they think, oh, because it's a specialty and it's such an interesting specialty and rare in a way, that I'm going to make more money with it. And sure, there's a possibility that you will, but you can't do it because of that, because you truly have to have a passion for that.
Oh, yeah. So I definitely know people where they're like, oh my God, Alyssa, you're probably raking in the money, like blah, blah, blah. Like you're lucky you like doing that. And I'm like, okay. First of all, no. Because if I was, I just picture myself on a yacht, because that's probably what I would like to do. You saw my face. I literally paused and I looked up into the air like, wow.
I saw
wow.
you on the yacht too.
No. I genuinely love what I do. I genuinely love it. Don't get me wrong. My patients know me, okay? They definitely know me. And it was so funny. One of them the other day was like, oh my God, Alyssa, I didn't shave. And I said, girlfriend, first of all, I was like, I'm about to get a wax, okay? Like, I'm definitely not shaved down here, all right? That's what's happening. And then I was like, do you know what I do all day? Do you think I care? You think I'm scared of some hair? I ain't scared of your hair. I ain't scared of that.
You know what? I feel like I've become so used to just seeing everything that I don't even notice anymore.
I ain't scared. That's right.
Like, I start doing an internal assessment and my patient will say, I'm starting to shave. And I'm like, I didn't even notice.
Yeah.
in my head.
Yeah.
Like,
no. And genuinely, I don't notice. Like, you know what I mean? Like, I don't notice. And this is like how much it's like clockwork and like we do it every day and stuff. But no, on the real, I really do, especially when I get that email, or like when a patient comes in and they are, and they don't mean to be surprised that they're doing better, but they're like so happy about it, and stuff too. That like that always makes me very, very happy, and it is very rewarding. It is very rewarding too. I say to them all the time, like if I'm able to have somebody pee, poop, have sex again, whatever it is, like I will always, always, always preach on a
Yeah.
soapbox. Hence my
And you can
podcast,
tell.
hence the,
Yes. Yeah. You can
everything.
tell you're so passionate about it, and that's what makes you successful with patients.
Sure. And
That's what it
same
is.
with you, hon. Same with you. And it's like, if you are a practitioner that is just thinking about getting into pelvic floor for the money, like, please don't do it. Like, please don't do it. It's just like, it is not, first of all, that's so wrong on so many levels. It's so wrong. And I'm not about that. I ain't ever about that. Like, you should be genuine about what you want to do.
Absolutely.
Yeah. And that just is what it is. And I think that's my RT for today. That's what I'm feeling.
Yes.
That is what I'm feeling. Chrissy, always a pleasure, boo. Always a
Thank you
pleasure.
so much for inviting me. This was fun.
Duh. Well, now this is like your
I think
second one,
you
so we're
and
gonna
I
have
do
more.
this. Oh yeah, you and I do this while we're not recording a podcast. So right now it was funny because we actually have to tame it down.
What?
You know what I mean? Like not go on a rant on all these
Oh,
topics for 2
yes,
hours.
yes, yes. Oh, no, because we go on a rant no matter what. And now
Yeah,
we're going
always.
on a
So,
rant again
yeah.
that people are going to hear, and it's totally fine. Bye. Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at _pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.